Just before the break, Dr. Lenny, Shruti was talking about some of the issues that everybody is facing. We also, we are not even doctors, but we get calls at all times of the day and night on this. So, Doctor, could you wanted to say something on this, Dr. Lenny?
So here is the advice. I mean, here everyone should understand that everyone has to work together. The patient, the doctor, the healthcare provider, everyone. So how do we go about this? There's a very simple thing. What I would suggest to you is actually give us a link where doctors can actually kind of enlist who are available for a consultation and give their timing that they are available for free to any doctor will be willing to do this in Goa. Any doctor will be willing to do it. So those people who are not really sick but who are isolating themselves even in hospitals, who can't get through to their doctor to come and see them, if they're having a problem, all of them are sitting with their cell phones. They can either put a WhatsApp or send a message or phone up a doctor available on one of these databases that you have got, where they can contact and speak, because number of times most of these patients are anxious. They're not really having too much that has to be done. They're more anxious. They need to speak to a doctor. And sometimes a face at the other end or the voice at the other end of the line telling them and reassuring them is all that the patient needs. And this happens in more than 60-70% of the cases. That is one suggestion. The second suggestion that I have is to the public, don't go and rush to hospitals. Don't call for ambulances when you're not really sick. My first suggestion, if you have a problem, call a doctor, call your family physician. Not satisfied with the family physician, call anybody on the list that Shruti provides. Get a second opinion before you decide to rush to the hospital, because more than 50% of the people coming to the hospital don't need hospitalization. You are occupying a bed because you have used influence to get that bed. And people who need the bed don't get the bed. It's sad that what is happening. And a request to all the powers that be, whether you are a bureaucrat or a politician, don't phone up the hospitals for beds, please. Let the doctors in the hospitals decide who needs a bed and who doesn't.
Let me go to Dr. Poonam. Doctor, you wanted to say something on this, Doctor?
Yeah, regarding the phone consultation or the teleconsultation. So Indian Medical Association has already come up with a free teleconsultation service for all over Goa, and there is a number. I mean I don't remember it by heart, but I can tell you the number. So if the person, whoever is COVID positive, has to send a WhatsApp message on that number,
it is 8767249828.
Yeah,
okay.
Exactly. Right.
Yeah, doctor, continue.
Okay. Yeah. So they send this message, patient sends this message, so-and-so message, what I told, to this number. Now this number, from this number, all over Goa, all the messages all over Goa will go to this number. There is a person who is segregating it to 7 branches of Goa. There are 7 Indian Medical Association branches in Goa. So according to the area that the person is from, these names are sent to that area. Like I am the Bardez branch honorary secretary. So me along with my team of another 2 doctors, Dr. Sophia and Dr. Priyanka, we manage these patients who are coming to us. We give it to our other doctors. So as of now, I have around 25 doctors who are willing to work voluntarily. So each of these 25 doctors are having anywhere from 5 to 10 patients. I'm just saying the arbitrary number. I'm not giving you an exact number. Anywhere from 5 to 10 patients at a time undergoing teleconsultation with them. So they keep a watch on them. Okay, is your saturation fine? Is your pulse fine? And if they have any problem, we help them in getting in touch further. Like I think till now, of all there were at least 4 patients who had serious problems with saturation. They were desaturating, that is, saturations were going down, and we helped them to reach the Asilo or to the SGDH. We have helped them.
Yeah. Okay. Now, see, I agree with both the doctors to a certain extent. However, from our experience, what we have seen is basically the system has failed. I'm not I'm not speaking negatively at all. Please do not misunderstand. What I'm saying is basically why I say that it has failed is because there is no coordination. See, you guys are professionals, very good, and I know that for the past year you all have been stressed out. This coordination leaves a lot to be desired. Now, that's the reason why we thought of bringing this message, and we would like your cooperation, because we will be there with you, Shruti and Dr. Poonam and Dr. Lenny. We will be there. The first time that you guys are together. So this message should go to the people. Is not gone. Sorry to say. On the ground, this message is not gone. What is happening, people are contacting Shruti or contacting Dr. Lenny or contacting you, Dr. Poonam, is through contacts, through this. But to the general masses, this message has not reached. Now, I would like Shruti to agree with me, disagree with me, or tell me what should be done, what should not be done. Shruti.
You're very, very right about the coordination part, and it's not rocket science. There are people who we have elected in power, who we have paid taxes to pay their salaries, and who literally have one job to do is to take care of the healthcare, right? And this is not even our.
Let me interrupt. If you're going to rely on them, you're not going to get anywhere. So let's keep them out of this discussion, please.
This system, they have the best of the bureaucrats, they have the best of the technologies, they have the best of the resources at their disposal, and we could have seen this through. This was happening in other countries, this was happening in other states. We could have been quick about it, and we haven't been. Abhi like 1000 ton wala kuch oxygen ka truck abhi aaya hai. Why did it take so long? Why did it not happen like 2 months back? Because we already knew this problem was going to come. There is one issue that I want both the doctors to address, because we are swamped with this, and since we are not doctors, we cannot really talk about it, is remdesivir and tocilizumab, which are trial drugs. Like doctors who we get from IMA as well, who would say that, okay, it's not really useful. You cannot get remdesivir in the market. You have to go to a government hospital. Despite that, there are hospitals that are telling patients that your patient will die if you don't find remdesivir for them or tocilizumab for them. And still the doctors keep putting the patients in a position where they have to go to the black market to get it. Whereas it's completely prohibited according to the guidelines, and we really don't know why do the doctors keep recommending it.
Okay, doctor, you speak about this first, then I will go to Dr. Poonam.
See, personally, whatever study, you're perfectly right, Shruti. Personally, there's a lot of data that is showing that remdesivir doesn't work. Now, having said that, whatever connections whatever discussions I've had with my peers in Goa and outside, some cases benefit from it. The others, most of them don't. Whether it's tocilizumab or whether it is remdesivir. Now, the issue is, it is up to the treating doctor what he wants. It's difficult for us to sit here in our own cabins and say this is right and this is wrong, when on the ground we are not there. So that is one issue. Second issue is, people have been hoarding remdesivir. I know this from the last 1 month. I have been getting calls from across the country. There is an artificial shortage being made of remdesivir, unfortunately, and the fact is that not everybody needs it, not everybody will benefit from it. And so this is a message to everyone. Please don't go out and buy remdesivir just because you may get COVID and you may land up in the hospital and you may need it. It is not required. That is what people are doing across the country. Please, for God's sake, stop doing that. Stop going and buying medications which are not required till your doctor says that you need it. If your doctor has not asked you, please don't go and buy it. Now, some hospitals do ask for it. I can't talk for them. I can't say it. But I'll tell you one thing, here in Goa, whatever cases I've come across, whenever there was remdesivir asked, it was because it was needed. It is needed at a particular stage of the disease, not needed at the later half of the disease. So please understand this. And yes, the WHO says it has nothing to do in COVID treatment.
Correct.
But having said this, WHO has spoken in various places. Sometimes they said it requires, sometimes it said it's not required. So the confusion is still there. Understand?
Yes, Shruti. Doctor, before let me get to Shruti. Yeah, Shruti.
Yeah. Why ask the patients to arrange for it when there is a clear guideline that only hospitals can provide remdesivir? Because a lot of government hospitals, including GMC, are giving prescriptions, including Salgaonkars, including Healthway, give prescriptions and ask the patients to go out and arrange for it, where there is a clear guideline that only a hospital and a nodal officer can provide it.
So, Shruti, the question that is being asked, it is actually not in the doctor's purview. We as doctors use our brain and hands and body to treat the patient. We are not the administrators. So this question what you are asking us should be asked to the administrators. Dr. Lenny, what is your take on this?
Absolutely. See,
We are
basically
not
what
into
happens
the
is it's the
administration.
hospitals.
We are not into administration. We are not into oxygen. We are not into the remdesivir. We are not into all these drugs that you are asking. Okay, so what a doctor anywhere can do is save the patient's life, whatever is in his hands. Now today, if the hospital where he is working, be it government or private, is not providing the drugs that are required, what is the doctor supposed to do? The final call is he has to at least ask the patients to get this if it is available. Otherwise, tomorrow, if we don't do that, I think you have been seeing the media all over. In Delhi, patients are coming and crashing on doctors. They are crashing doctors. Okay, now is that a doctor's mistake? It is not doctor's mistake. Providing oxygen is not doctor's job. It is job of the administration to come across over there. We do not prepare oxygen at our home.
Absolutely.
No,
Right?
but actually, doctor, I don't think she's blaming you. She just wants to know
No,
what
I'm
is the
not.
thing.
Neither am I blaming her. I'm
Correct,
saying
okay.
this discussion requires the administrative part who all are not ready to answer.
This is the issue that we are, in fact, she's trying to make it, and that we also trying to make it. This is the issue that is happening, and this we can see. See, nobody. I don't think
Everyone
anybody.
can see it.
No,
Everyone can
show
see it.
Yeah. If through this show, if administrators can be held accountable for this, please definitely they should be looking at this. Anybody from the government, that please don't put
Yes.
patients in a very panicky situation where they cannot afford it, but they still want to do everything in their power to save their family.
A doctor will do any possible to save his patient. No doctor likes to lose his patient. So
Yeah.
when they inform the patient's relatives that, hey, listen, I don't have this drug. It's not available in the hospital. We are in short supply. Can you do something? It is that is why people are given this, because there is a genuine short supply, and somehow people are not getting it. That's why I said don't hoard it, because a lot of people are hoarding it.
Correct.
Yes, the administrators have to do it, the hospitals have to do it, but I think the general public also has to understand that it is not required for anybody, so then they can hold it,
The point here is that, see, we are not, neither the media nor the people nor civic society nor the NGOs who are trying to nobody is blaming the doctors. We know what the doctors have gone through in the past year. We know that, we are aware, because we are in constant touch. See, that's why we've not been critical of the doctors at all. What we are saying is that today there should be coordination. 35 to say 40, 50, 45.
So it comes when it comes to the 40-year-old and the adult population. I think most people are really worried about what is going to happen, so they panic once they get it. So my advice to them is the same: don't panic. For them, unlike the previous wave, this wave is a little hard. Even the youngsters at the age of 25, 30 are getting it. They get hit very hard. They get hit, and by the fifth day, some of them are very serious and end up in the hospital. So you need to kind of go to your doctor right at the beginning, get in touch with him when you see the first signs and symptoms. So that is my advice to most of the youngsters. And every time you get a fever, start with a dolo. You can take up to 4 a day. Don't go beyond that, or any paracetamol that you have in hand. But always connect to your doctor and see what best you can do. So that is my advice to everyone. But most people in this age group, that is the adult age group, if you do things early enough, you will not reach a hospital. You can take care of yourself at home. 98% of this population can be treated at home. You don't need to worry. All you need to do is ensure that you keep yourself safe, wear your masks, don't go out unnecessarily, do the necessary things, because these days it is rampant, everybody's got it. Soon we will reach the herd immunity and we'll all be out of it, but these days you need to be extremely cautious and do what is required of you. If you're not infected, please stay at home. If you're not required to go out, please don't go unnecessarily to the market. Don't panic buy when somebody says tomorrow there's going to be a lockdown. Today everything is available and brought to your house. You don't need to go to the market and create a crowd there. So these are some of the things that we as general population can help the entire community of doctors and the entire health infrastructure to kind of cool off if we take precautions at home. And that is my advice to everyone at home.
Dr. Poonam, anything specific besides this for ladies, for women, working women, because a lot of women are out. Mothers.
So, you see, working ladies will have to go out to work. I mean, this is a micro lockdown which has been put down from today onwards, but then we really don't know what is the future plan. So, even if we open up, the one advice that would go, working women or working gents, everyone has to go back to work.
Absolutely.
But please follow your COVID etiquettes. Please follow your COVID now. That doesn't mean to say that you are eligible to remove your mask under the nose and under the mouth and now on the chin. I received one forward saying that chin se aaya to chin pe nahi hona chahiye mask. Understand? So it is the mask has a purpose. All the areas from where the air is entering your body, that is the nose and the mouth. Okay, those have to be covered. And now the latest guideline says double up the mask. Okay, so wear a surgical mask inside, that is the blue and the white color mask which you see, and then wear a cloth mask on top. That is what has been the doubling up of the mask. Okay, so if possible, please do that. Don't be under the, the rum we say, under the wrong notion that these are people, nothing has happened to them, because one person from that office will come positive, and most of the offices are AC nowadays or centralized AC, and it's such heat you cannot stay without AC. Okay, so the circulation of the virus is quite rampant in such areas. We are seeing banks getting affected. We are seeing full hotel, hotel employees getting affected. Okay, full office getting affected. Okay, because one person is come positive, his neighbor is positive, then the neighbor within the office, they have small cubicles. No? So everyone is coming positive one after the other. Okay, the second would be, going to office is a necessity. We cannot say no, just do a lockdown and make people sit down. Yes, it is important, but going to office is also necessary, because even if they do lockdown, there will be some part of the society which will anyway have to go to the work, like the healthcare workers or some administrative workers, they will have to go to the work. So these people also have to be careful. Now, having said that you have to go back to your work, going to weddings, going to parties, meeting your friends, going to naming ceremonies, going to someone's birthday party or to fulla of someone is not important presently. Okay, so presently what we have to say is not bhupachi garaz na, we have to say jagpachi garaz asa. So we just have to leave now, leave this moment with your family, I would say, rather than with your friends. Okay, the friends will be there, they'll be there entirely. You can do a Skype call, you can do any other call, but don't go in that. I have seen weddings with all 5 days of wedding ceremony. During my time it was not there, but nowadays everyone is having 5 days of wedding ceremony.
Goa,
so
yes, it's a very
they
surprising,
are not required. Yes, destination weddings. I don't know now whether they are there, but they are there. Even Goans are having weddings, huge type of weddings. You don't require them. You don't require all these things. At a point when another family is losing their near and dear ones, tomorrow it could be you. I tell my patients, you decide whether you want to jump in the pit. Okay, you don't want to jump, just stay back home. One more thing I want to bring up over here. Most of the patients recently, whoever is come, mostly they have been to some party, some wedding, something. So that there's something known as acceptance. You have to accept something. When the pandemic is there all over world, we know a fever. We have to first think about COVID rather than other things, because rule out that and then think about other things. This is what happens in any pandemic. So when I say, Baba, this fever, we have to be careful. Please get the test done. They will say, no, doctor, baby ate ice cream during the wedding, teja khatir zala. Ice cream will not kill the patient, okay? The COVID maybe. So first thing is, if your doctor is telling you, go ahead, go for test, please go ahead. The doctor is telling you because he has much more knowledge than you. Okay, please go ahead with the test and follow the norms. Follow the SMS, which I usually go on telling at the end of each and every video of mine. The safe distance, mask, avoid social gathering, and sanitization of the hand. That is, as doctor said already, hand washing is most important than just using sanitizer. Sanitizer, yes, when you go outside, sanitizer is fine. But when you are at home, please see to it that you wash your hands properly, following all the steps of hand washing. Yes, that's it.
Shruti, now tell me one thing. Last closing statements. What do you want? What do you feel is the solution to the problems you are facing? In short.
One is to take Dr. Poonam's point ahead of getting tested earlier. Anybody who's watching the show, I would please request get tested as soon as possible, because in Goa you are getting your test results after 7 days. After 6 days and 7 days, and if you are having any complexity, the hospitals will not admit you unless you have a COVID positive report. So please test if you feel some symptom right away, so that if there is some severity, you have this thing. Another one point I want to make it to young people who are watching it, because we are not usually prepared with all this. Please talk to your parents right now and keep the insurance papers handy, and you should know how to use insurance paper and how to use how to talk to the hospitals for it, because you don't know if you will have to end up in a private hospital, if you can afford it or not. And we are facing a lot of such queries from young people who just come and say, okay, my father needs a ventilator and I don't know how to arrange money. So we are having to even help them with paperwork. Some of us who, in fact, humko bhi nahi aata tha iske pehle. Now we have also learned how to use insurances and stuff like that. Yeah. And that the solution to this, I think, is the government to proactively get involved in the whole process. It's not just about arranging oxygen or arranging beds or expanding beds. It's a very holistic approach that I think any administration needs to take, and we are nobody to teach the government. They are way mightier than us. But there are a lot of citizens in Goa who want to help. In fact, we want to help in any which way, and we have been doing since last 2 weeks, and we are ready to give out any support possible, because we know because this wave is not unprecedented. Last year you can get away by saying this is unprecedented, but this year you had entire 1 year to prepare. So now anything that you do is not unprecedented. This is something that you should have done like 3 months back. And honestly, I don't know if I should say this on a show or not, but more people are not really dying of coronavirus. They're just dying because they're not getting the right kind of facilities on time. And this was completely preventable. Deaths were completely preventable, and it's so heartbreaking for us volunteers as well, because every single day there are so many people we are trying to help, and the message comes, please don't bother, the patient has passed away, and then we really don't know what to do after that. So I think we need more people from the government efficiently working, and it's not just the health department, it's the IT department, it's the health department, it's the administration, everybody hands-on working on this. And please create a database. I don't know how practical it is and why the government is not doing it. Please make an open database that tells patients where the bed is available, and allow them with their Aadhaar card and their COVID positive report to book that bed before they go there, because there are patients who are stranded at the middle of the night because the place that they went to, there is no bed available anymore, and they don't know what to do with the patient. And yes, and please have a helpline number that actually works, that actually connects at professional helpline who knows how to help a patient, rather than just
Shruti, here I would like to ask one question. Did any of the patients complain that they couldn't go through the IMA helpline for the teleconsult?
No, IMA helpline is completely working. It's the 104 helpline that people are mostly...
Because we have been getting so many cases for teleconsultation.
No, but we are talking about the 104. That's where the first person directly calls that number, like police, 112 or 100 or whatever. That way.
Okay.
Yeah, Shruti, go on. Yeah.
Okay. And yeah, so IMA is somewhere where we have been redirecting people, because we are not doctors, so we cannot advise people. There are so many IMA doctors who even they are great at calming the patient down, and even telling them some home things that they can do, is like proning, where you lie upside down on your stomach, and things like that. So it's been very helpful. But these are the things that 104 also should have been able to do, have trained people who can check the bed availability for you, who can make the phone calls for you. And if anybody has any query, we have tried to make as many verified database on covidcaregoa.in. All the numbers over there, every single day, every 4 to 5 hours, our volunteers call those numbers, check if the numbers are working or not, so that if you're in a panic situation, you don't have to call 20 numbers that don't work. So there is a database available. Government is free to use it, please, because it's taken a lot of hard work from the volunteers and the citizens of Goa to put it together. So please use that, and please, now it's enough. And आपके पास 1 महीना भी हो गया second wave, so now you cannot be not for the whole thing. Just you can wait. This cannot wait. Whatever money it takes, put it here. Expand beds, expand hospitals, expand more oxygen cylinders, put up an oxygen plant. We have seen this in Gujarat. There are oxygen plants that can be put up within a week at just 35 lakhs ka cost. Why can't our government do this? It's not even a big cost. So,
Absolutely.
yeah, I think these are interesting remarks that there are a lot of solutions available out there. Let's be ready to learn from other states and implement it over here rather than working on our own inefficiencies right now.
Absolutely. Lenny, closing statements? Dr. Lenny?
Yes, my one statement to everyone: we are in the middle of a pandemic. This is a war zone. You need to treat it as a war. Everyone has to get together and work. It's no time to blame anybody. It's no time to say we should have been ready. It's just get out there and get going. And in this, I think all of us in the medical community and in the healthcare facilities everywhere would like to ask every person in the public, every patient, maybe a patient to be, to first try and avoid coming in contact with this virus. Try to do what has been told to you best, because that way you will lower the load on the entire healthcare system. Otherwise, it's going to collapse. This healthcare system was not meant to fight a pandemic like this. It was meant for normal day-to-day work. We had enough beds, we had enough oxygen, we had enough doctors to take care of it on a regular basis. We never needed this. Today we are in this situation, and so we can do our bit by not putting the healthcare system under more peril or more load. Just stay indoors if you are not required to go out. Just for a few months, just for this 1 month or 1.5 months. After that, things will pass off. We will manage to get over this. We need to be smart when we are attacking this. You can't do it, with your brawn. You can't say, I will manage everything. No, stay at home. Do the best you can not to go into crowded areas. Don't create crowds anywhere. That is the first thing that we need to do. Second, if we think that we are sick, like I said again and again, do not panic, do not run. Do not phone up your closest friend who's a politician or a bureaucrat or somebody who's somebody to get a bed for you in the hospital. It is not required. 98% of the people can be treated at home and can be treated by doctors over a phone consultation. It's the 2 or 3% who will end up in the hospital. Let the hospitals handle them at peace. They will be able to do it, and they'll be able to do a better job if everyone doesn't run to the hospital. So a request to everybody to try and be calm in this situation.
Thanks a lot, guys. Thank you very much for helping us pass this awareness on to our viewers. Thank you very much, and keep watching Goa 365.